All right, welcome back. All right, gentlemen, so let's paint the big picture within a larger context. Hugh, you started this when? MyDocNow actually started when?
About a year and a half ago.
A year and a half. Okay, so that's really young. Okay, and then why did you choose Philippines? This has been going on in the United States.
Well,
why the Philippines?
It's not a complicated reason I lived here. So really, part of my
So you're half Filipino already, Hugh.
Yes, part of my background, I've been in the venture capital business and so on in California. So I'm used to looking at ideas. And it's very typical of people in the venture side. They'll see an opportunity, they'll put some people together, and they'll just get started.
Yeah.
Clearly, healthcare at a digital level here in the Philippines is somewhat behind the world, to be honest with you.
Yes.
Digital being defined, how do hospitals use e-health or that information, social media, Twitter, they're somewhat behind the curve. If you compare, for example, a major like the Mayo Clinic, for example.
Yes.
And so we decided to take some of those concepts and bring them here. One of the largest health institutions in the U.S. called Kaiser.
Yes.
Does about 10 million.
Kaiser Permanente? Yeah.
Kaiser Permanente does about 10 million visits a year, primary care. 5 million of those are e-health, virtual visits. Wow. So they've recognized that they can do a dramatic good for patient engagement and satisfaction by going virtual. So that's what they do.
Yes.
So actually, they're kind of a gold standard.
So it's convenience also for both the doctor and the patient and the patient's family.
Generally, they found for doctors that practice telemedicine, they'll increase their revenue about 25%.
Yeah.
And that's because, well, it's very interesting. When I with Mike, we'd go trips. I would say 3 to 4 times during the trip, a patient calls Mike. Okay. He gives advice and he gets nothing out of it. He's not paid. So one of the real enhancements is for a doctor who has a large patient base to be able to talk to the patient and get paid.
Yeah, so how does that work? What percentage, how do you price or cost this out to doctors? How many doctors do you have in your registered in your system? How do you vet? Are they all doctors? Or do you have like certain levels of...
We have about 100 doctors that are signed on our system. There's a vetting process, of course. They have to be that Mike has set up to approve the doctors. Once they're approved, they come on our system. Doctors can have individual charging sheet for their patients, and our system allows that to happen online. We have some specialists, and we have access in our capability to about 38 specialists in the U.S. So we're using a very sophisticated, well-accepted software program in the U.S.
That means I can access a doctor in the
U.S.?
U.S.?
Yes, you can. Avizia, which is our software provider, they're in about 1,000 hospitals around the world, 2 million patients, and a subset of their capability is for us to align with specialties they have. So, for example, a patient here wants to get a second opinion through a specialty, they can work through us into our Avizia system.
Is there a certain level or a certain type, doc, for, let's say, a patient? Let's say if you deal with cancer patients,
yes.
Or, I mean, there's a certain level where a customer or a patient would call and say, I don't feel very well today, I have the sniffles. So that's kind of the easy stuff.
Yes.
But is there a certain limit to where you're going to say, no, you're going to have to go physically?
Yes, definitely. Yeah, we have a referral system. That's what's called a referral system, both locally and internationally. Okay, depends on the needs of the patient. Okay.
But would you say the majority of the people who actually, that you serve,
yes,
the types of calls,
yes,
are what types of calls?
Majority will be primary health care, where a family medicine practitioner or a general practitioner can help the patient by giving information, maybe quick fixes.
So typical calls would be about?
Fevers, pain, what to do, information. No? What medicine should I take?
Non-life-threatening.
Yes. No? And we do have a partner for life-threatening events.
Yes.
If somebody says, my chest is tightening. How old are you, sir? 75. Oh,
no.
That's not good. And we have a partner which is Lifeline. No?
Yes.
Lifeline is our partner here.
Yeah.
We can send a doctor, an ambulance, or a nurse, or even a med tech to take some blood samples, no? Or to take care of you, to get your blood pressure, to do CPR if needed.
Yeah.
So we're partnered with
Oh, that's good.
Lifeline.
So how do I become a member? Or how do I? Is it a subscription?
In general, it's going from the provider side to their patient base, whether it be a hospital to a patient. Lifeline is probably the most clearest to what I call a consumer-facing group. So for their members can call in. We have not focused on the general public as per se. We have a new app that we will be bringing out here shortly, which I call Hospital in Your Hand, where in one device you can talk to a doctor, or have a doctor come to your house, or nurse come to your house, or do lab results to your house, or if you have order medicine, all in this one app. And once that occurs, then I think we'll have much more exposure to the public.
So not so much retail yet,
No.
but more on the wholesale. So on the wholesale side, there's Lifeline. Hospitals would now hook up with MyDocNow?
I would say a couple obvious ones would be insurance companies, for example,
Yes.
and large call centers. We have a proposal pending for a large insurance company where we would cover all their members, for example. So any of those members could, if they want to talk to a doctor, would work through us. So actually, in the U.S., every major insurance company in the U.S. has a covered benefit for telemedicine. In the U.S., every major one, 75% of employers over 1,000 offered telemedicine as a benefit for their employees. So it's quite extensively moving into what I call the business-to-business area.
I would assume there's also a large benefit plus for the insurance. And
well, it certainly is. There was a kind of an interesting case I saw last week where a lady took her young child into urgent care at night. It was a fairly minor thing. They gave him some medicine, and they would charge $3,000 US.
My goodness.
So the average urgent care cost in the U.S. is $1,200. So if you have a choice of doing,
you cannot afford to get sick.
You cannot afford to get sick in the U.S. That's exactly
even
right.
Here.
Yeah, even here.
We cannot afford to get sick, and that's why we have this.
As soon as you hit the emergency room, that's it. No?
That's it.
Yep.
It's either the bill's going to kill you or whatever it's just going to kill you.
That's right.
And having access to the doctor's professional opinion before going to an emergency room is critical. It's critical. A good doctor can prevent probably 80% of these people who are contemplating going to the emergency room. In fact, the reason why they go to the emergency room is because they don't have enough information.
Yes.
They don't know, is this an emergency case or not? No?
Yes.
Will I benefit by going to an emergency room and exposing my children to
That's right.
to all the germs and in
might
a hospital
make it worse.
setting? Yeah, might make it worse. I know many cases where it got much worse. No?
Right.
Personal cases. And as much as possible, I tell my patients, when you want to see a doctor, ask if you can see a doctor in a clinic outside of a hospital setting. Because these infections, we call them nosocomial, those that you get from hospitals, they're difficult to treat, which is why they survive in the hospital.
That's horrible.
Yeah, difficult to treat. So it's always it's a last resort to go to the hospital. I think the first option is call a doctor, or call us. We'll tell you.
Yeah.
If you need to go, we'll tell you that you need to go. But if you don't need to go, as much as possible, don't.
Yeah.
In the U.S., they have maybe 500 million primary care visits per year. I think the estimate is maybe in several years, about 300 million of those can be handled through a telemedicine experience. So, and the experience so far, I would say, is that a high level of customer satisfaction, 95%,
Yes.
covers the problems at the first call. Also very interesting in the U.S., some of the major vendors have never been sued. So one of the problems in the U.S. is legal suits for healthcare. Just doesn't exist in this area. So it's been quite phenomenal.
Phenomenal indeed. All right, we're going to cut to a short break. You're watching BizNews. We'll be right back.